Hi guys, I'm going to be talking about for my career presentation on physical therapist assistants. The responsibility of a PTA is to work closely with a team of physical therapists, as a physical therapy aide and other PTAs to rehabilitate patients who are working to regain their full range of motion and strengthen their muscles. So first, they have to observe, they have to record careful notes about each patient's progress so they can work together with a physical therapist to determine the next best step in a patient's recovery. Next, they have to do, let's say, a patient family education. So they're not only does the treatment end, a patient's treatment continues after their stay in the hospital or wherever they're going. They have to stay educated to make sure that the family's keeping an eye on the patient, that they have the right exercises and all that. Another way is a therapeutic massage. So basically what this means, this is to help patients regain their type of motion through massaging their ligaments, their joints, and all of that. Now this might sound unusual, but they also do ultrasound therapy. This releases sound waves that can increase the blood flow and reduce the swelling of the muscles. They could also do prosthetics and communication. The most important part about communication is that that you have to keep talking with the patient, keep reassuring them, and you also have to report to the physical therapist what happened that day. Okay, next I'm going to be talking about the job setting of a physical therapy aid assistant. They could work at a rehab slash sub acute rehab. They could work at an extended care facility, a nursing home, a skilled nursing facility. They could also work at an outpatient clinic. They could work at a school or a preschool if their patient needs to go to school and they can't miss it. They also have a wellness, prevention, sports, and fitness part where they just stay with the physical therapy, or they stay inside, with the sports teams and just keep an eye on them. And also, usually they're also in hospice and industrial workplace and other occupational environments. What this means, they could be located also as at factories, warehouses. So what job education for this to be a physical therapy assistant is, they must earn an associate degree in physical therapist assisting in order to practice. You need 1 year of clinical experience, but you could also get this with a bachelor degree of health science, which is beneficial for all of us. Some great skills that you need to be a physical therapy aid assistant is active listening, administering traction to relieve neck and back pain, applying diagnostic muscle, nerve, joints, and functional abilities tests. Assertiveness, you have to be assertive to force the law on the patients, basically. A job outlook is that there's a high demand for physical therapist assistants in the workplace right now because of the economic downturn. According to the Bureau of Labor Statistics, employment of physical strength is expected to grow by 40% from 2014 to 2024. That's actually pretty good for all of us that are going to be graduating soon, like 2-3 more years left. We'll be able to get a job as long as you pursue this with our Bachelor of Health Science. So the career path to do is get a degree in health science, or you could get an associate's physical therapy assistance degree. You have to volunteer with a physical therapist, a healthcare practitioner, or a local nursing home to gain the experience. So why I chose this is because I wanted to help people. I wanted to give people hope. I didn't want to tell people that there are other options and that they don't have to give up right now. Okay, and all the sources that I used for this are, I used the APTA, the About Physical Therapist Assistant Careers. I used the Rasmussen Education, and I also used the Physical Therapist Assistant Education from Allied Schools.